Hi there, Miss Imogene. My name is Angie. I'm going to be your nurse today. I'm going to be taking care of you. I just wanted to let you know I just received an order from the doctor for you to receive some Lasix or furosemide through your IV. So first things first, can you tell me your name and date of birth? All right, Aunt Imogene, date of birth 8/28/1959. Perfect, that matches what I got here. And allergies, I have that you're allergic to penicillin. Is that correct? That's what's also showing on my band. All right, so that's correct. Great, so I just wanted to give you a little bit of education on the medication you're going to be receiving. Have you ever received furosemide or Lasix is sometimes what people have heard of before? No? Okay. So what this medication will do, it looks like you have some fluid on your lungs. That's what we can hear when we listen to your lungs, and that's kind of probably what's been causing some of your shortness of breath. And so what this will do is it will help to pull that fluid off of your lungs. But when we pull it off, the way we do this is it kind of functions throughout your kidneys, and it will help pull the fluid by increasing your urine production. So that being said, you're probably going to have to go pee quite a bit when we give you this medicine. It's very important that you do ask for help whenever you need to go to the bathroom. It can make you your blood pressure drop a little bit, so you could get lightheaded, you could feel dizzy. We want to make sure you get up slowly. So, and anytime, with you in the hospital and everything and your cables and everything, we would just feel a lot better if you would use your call light and ask for help when you need to go to the bathroom. So do you have any questions for me before I go gather supplies and get the medication from the Omnicell? Right, so no questions? Great, I will go grab that and then I will be back so we can give you that medicine. Alright, I'm back, Miss Imogene. Set the supplies down here. Working height. And now we lower this. And we will set up our supplies here. So my orders called for 40 milligrams of Lasix IV push, and what I have available is 40 milligrams in 5 mLs. I looked up in a drug book to see the rate in which I can infuse this in your push. So it says to push 20 to 40 milligrams over 1 to 2 minutes. So we're doing 40 milligrams. I think it's safer to go with that 2-minute mark. Push it nice and slow. I do not need to dilute this. So I can just pull straight from the vial. Could have used a 5 or 10 ml syringe, but I went with a 5 ml syringe here. Okay, so making sure I have no air bubbles in here. Let me pull out my 5 mLs here. Okay, so with Aunt Imogene, we are giving Lasix, which does not need to be reconstituted or diluted. So the question is, what do we do when we get a medication that does
require reconstitution or to be diluted. And so I wanted to take a quick moment to just do a few different drugs, pretty common drugs that we might see that you can then understand how you might reconstitute or dilute. So let's start with our first drug here that I've got listed, which is Protonix 40 milligrams IV push, and we reconstitute that with 10 mils of normal saline. So what you will typically see is Protonix comes in a powder. It's usually a white powder, but for practice purposes, we have this yellow powder, all right? And whenever it says it's normal saline, we can use a flush for that. So I've got my flush, and it says 10 mils, so this is 10 mils here. I've got my powder, I've got my blunt tip, and I've got my alcohol wipe in. And so, take my cap off here. Let that dry. So I can just uncap my flush and put my blunt tip directly onto that. Now, to know, how much to dilute with or reconstitute, we can always just refer back to our drug book. It'll help us with that. It'll also then help explain to us how quickly we need to push the medication. So I'm just going straight in with my blunt tip here. Make sure I get that all mixed up. Okay, so I would just make sure I've got all of the powder out of there, and then I've got my reconstitution of 10 mils. Okay. So I can recap that with scoop method if I want to use that. It is important that when you're doing this, keep your vial to be able to scan in your medications. And then also, if you are doing multiple medications, then you might want to put some type of label on your syringe to make sure Protonix is a prime example, because whenever I do this with the normal powder, it is a white powder, so it's clear, so it can sometimes be very difficult to distinguish my actual flush from my Protonix. And I don't want to push, if I'm just checking for patency in my IV, I don't want to accidentally push that Protonix instead of my flush and then push it way too fast. So I do want to make sure I've got some type of label or something to help me to distinguish my actual medication from my flush there. So that would be my Protonix ready. Okay, so next I have an order for morphine 1 milligram IV push. This will typically come in a Carpi Jet at the hospital, long, skinny vial, but it all is the same. We're going to use this practice vial here. I would say most commonly you might see 1 milligram per 1 ml, and then my drug book or Epic or whatever system you're using then will typically say to dilute this with 5 mils of sterile water. Now it's important to recognize sterile water is different than a normal saline flush. So I have actually pulled my sterile water 10 mil vial here that I will then use. And then I would just pull my morphine, however it is supplied. I need to make sure that I pay attention to that. Because it is saying to dilute with 5 mils of sterile water. So if this is 1 milligram and 1 ml, I would have 6 total. If it was 1 milligram and a half a mil, then I would have 5.5 mils total. So I just need to make sure I'm paying attention to how much morphine, how it is constituted in the vial itself, to then recognize what my total amount would be. So since it's over 5 mils total, either way, I'm going to pull a 10 mil syringe here. And I'm going to pull my blunt tip. Let's start with my diluent here. And I just need 5 mils. No air bubbles. Okay, so I've got my 5 mils there. And then my 1 milligram of morphine, which is 1 ml. Okay, so I would have 6 total mils in my syringe here. And again, you can just do that. You can, you know, sometimes people like to just roll gently to make sure that that is nice and mixed within my syringe. Again, I'm going to keep my vial to be able to scan that in. You know, say that would have been, in some instances, your morphine might come where you're doing a partial dose. So if that would have been a 2 milligram vial, say it was 2 milligrams per 1 ml, then you'd be giving the half mil. I would have to waste the other half with another nurse there. So here's where I would have my vial. I would again have that, save that to scan it. I definitely want to label my syringe so I know that I've got the correct medication there. Then the next medication we have here is Pepcid 20 milligrams IV push. So Pepcid then here comes in 20 milligrams per 2 ml or 10 milligrams per mil. And my drug book said to dilute every 20 milligrams or 2 mLs with normal saline for a total of 5 or 10 mLs. So I can do it a couple different ways. I personally would have my pop my cap off of that really quick. And if it says that I'm doing for a total of 5 or 10, and this is 2 mils already, then I really only need to add either 3 or 7 mils from my flush, okay? And since it is normal saline, I can use a flush. I'm going to go to the sink really quick, and I'm just going to empty out 7 mils from this, so I've got 3 mils already in this syringe to then pull up the other 2 with my flush. Let's do that really quick. Okay, so you can see here I've just got 3 mils in my syringe. I'm going to put my blunt tip on. So I pulled the 2 mil up from that, and I have my 5 total mils in my flush. My reasoning for doing 5 versus 10 is again because this looks so much like a flush. It helps me, you know, even if I put a label, but it's going to help me recognize, you know, my flush has 10 and my medication has 5. So it helps eliminate maybe the accidental risk of pushing the medication first versus the flush first. So now that I've got all 3 of these prepared, I'm going to go back and finish just giving the Lasix to Miss Imogene. All right, so let me clean and make sure we got a working IV here. One mnemonic I really like to use is called USACD. And when I'm dealing with flushes and dealing with giving medications, so I unclamp, I swab. Obviously, I am checking patency of my IV, and I can administer, and this goes for flush and medication here. So this is just making sure I've got a nice working IV, which I do. I got great blood return. It pushes without difficulty. She kind of feels that, can taste a little bit. So we know we got a good working IV there. So I am now going to take my 5 mils, and I know math-wise that comes out to 2.5 mils per minute. Get it where you can see my mils here. So I am looking at the second hand on my clock. All right, and I'm going to just push this slowly. I'm going to push that first 2.5 mils over 1 minute, doing it gradually, not 2.5 mils at once and then waiting another minute, but pushing slowly to make sure she's getting all of that medicine. Again, Miss Imogene, you know, if you have any pain or burning when I'm pushing this, just let me know. We don't want that IV to go bad. If you have any ringing or anything in your ears, also let us know. This medication does have the risk of it's called ototoxicity, or it can cause some damage to our hearing if we're not careful. Very rare, but can happen. So if you were to have any ringing in your ears, it would be something to keep in mind. Again, you are going to be peeing a lot more. So if you do need to get up and go to the restroom, please use your call light so we can help you to the restroom. Also, another thing is it can, when we're pulling off that fluid, that will also lower your blood pressure a little bit. So that being said, when you stand up, you know, we want to stand up slowly. Could make you feel a little lightheaded whenever you stand. So please let us get up take you to the bathroom so you don't get faint or fall or anything like that, especially since you've never had this medication before. We want to make sure we know how you respond to it. So I am right at that 2-minute mark here. Can disconnect. And then with this second flush here, I do want to make sure that I push this at the same rate that I was the medication, because there's still medication in that J loop. So not that the whole 10 mils has to go at that same rate, but I want to do a good mil or two just to make sure I've completely got all of the medication out of the J loop and out of the catheter in the arm. And once we have that, and I know I have pushed that flush slowly, I'm not going to slam the rest of the flush, but I can go a little bit quicker than I was. And whenever I go back to my USACD, so I had my unclamp, swab, administer, then CD is clamp. So as I'm finishing up that flush, I want to clamp, and then I can disconnect, okay? And this just helps with pressure in that catheter, kind of help keep it patent. Also helps with the pressure activation on the device here at the end. All right, so let me raise the rail back up on your bed here. Feeling okay from having that? Get you lowered here. All right. Do want to make sure as I'm cleaning up my trash, you have your call light there with you, so you can call us if you have any questions at all. If you need to get up and go to the restroom, please let us know. All right. Thank you so much, Miss Imogene. If you need anything, please do not hesitate to ask. Home out here. All right. Thank you.